today we'll be discussing about diabetes and eye. So when we say diabetes and eye, the first thing that comes to our mind is diabetic retinopathy. But is that all? No. It can affect multiple layers of the eye, right from anterior to posterior. So how is it affecting? It basically affects the blood vessels in our body and does in our eye, causing something called as microangiopathy. Secondly, raised blood sugar causes a decrease in our immunity and gives rise to multiple opportunistic infections. So how can it present in the eye? Right from anterior to posterior, it can first affect your lids. It can lead to something called as TIE, multiple lid infections, painful lid swellings. It is an indication that either you should get your diabetes checked or that your diabetes is uncontrolled. Secondly, it can cause a diabetic cataract, diabetic glaucoma. So glaucoma is basically an end stage of retinopathy, what we call as a neovascular glaucoma, where you start getting pain, redness in the eye because of raise in your intraocular pressure. Then the jelly inside the eye can have a bleed, what we call as vitreous hemorrhage, secondary to diabetic retinopathy, which will present with floaters, sudden diminution of vision. Then we can have diabetic retinopathy, which we'll be discussing in our next segment. And it can also affect the nerve that is connecting the eyeball to the brain, what we call as optic nerve. So it will present with diabetic papillopathy, your color vision will have problems, your diminution of vision can occur, and sometimes it can leave a permanent mark. Apart from that, outside of the eyeball, your extraocular muscles which are needed for your movements of the eyeball can suddenly go into paralysis and you will land up in squint. This is because the nerve supplying to the muscles get damaged, get paralyzed because of raised in blood sugar. Apart from that, orbital mucormycosis. So mucormycosis is a term you would have heard in context with COVID. So it is an opportunistic fungal infection which occurs because of decrease in our immunity. Orbit is a bony part of the skull in which our eyeball lies. So once this mucormycosis occurs in orbit, it has devastating complications. The treatment often includes removal of the eyeball and it's a mutilating surgery. So what are your take-home points? A. Control your diabetes, and B. We will give you the best possible care for your eye, but if your diabetes is uncontrolled, it goes to waste. Thank you.